Okay, let's dive in. We've got a really interesting mix of source material today. We're sort of pulling back the curtain on how healthcare quality is built,
Hmm,
and maybe more importantly for you listening, how you can navigate making those big medical decisions for yourself.
exactly.
We're talking about understanding the systems behind good care, but then really zeroing in on something very personal. Getting a second medical opinion, but doing it the right way.
That's the key, isn't it? The right way. We've looked at, different pieces of info on the big accreditation bodies, global and national ones, setting standards.
Okay.
Then insights from a consultancy, Supreme Medic, that actually helps hospitals meet those standards.
Great.
And then some really practical boots-on-the-ground guidance on second opinions, specifically from their materials like blog posts and even a podcast transcript they did.
So the mission here is connecting that big picture quality standards accreditation with your individual journey. How do you navigate the system, especially for something like a second opinion?
Precisely. It's about bridging that gap between the system level and the personal level.
Okay, so let's kick off with that big picture then.
Yeah.
Healthcare quality, safety. Fundamentally, what are we talking about, and who are the key players trying to make it happen?
Well, at its core, it's about making sure the care you get is, effective,
Yeah.
safe, centered around you, the patient.
It's about trust, really.
Absolutely, trust is fundamental. And you've got these organizations working globally and nationally, kind of setting the benchmarks. Think of them as the architects, maybe,
Yeah.
designing the blueprints for quality in hospitals and clinics.
Okay, architects. I like that. So who are some of these big architects we saw mentioned in the sources?
Well, Joint Commission International, JCI, is a huge one. The sources really highlight them as a global leader. Quality, patient safety, that's their focus.
And their mission, what are they actually trying to achieve?
Their stated mission is to enable and affirm the highest standards of healthcare quality and patient safety for all. And their reach is pretty incredible.
How so?
They're in over 70 countries, accredited more than 1,000 programs. They've got something like 600 experts worldwide working with them. They're basically writing the rule book, these really rigorous international standards that hospitals aim for.
Including those patient safety goals I saw mentioned.
Exactly. The international patient safety goals are critical. They cover things like correct patient identification, communication, medication safety, really core stuff.
That scale is impressive. And it's not just the big accreditation stamp, is it? The sources mention other things they do.
Oh, yeah, definitely. They offer specific certifications, too, for things like clinical care programs or even newer areas like telehealth, which is obviously huge now. Plus, they do advisory work, education, helping organizations actually improve.
And what about the impact? What did the sources say about how JCI accreditation actually affects hospitals?
That was really interesting. The testimonials stood out. You had one hospital president calling it the best team-building exercise because it forces better coordination.
Huh, interesting angle.
Yeah. Others mentioned it gives a competitive advantage, helps build community confidence, which we talked about improves risk management, and, crucially, helps create a real culture of patient safety.
So it's deeper than just ticking boxes for a certificate.
Exactly. It's aimed at these deep operational, even cultural shifts. The goal is better, safer care in the end.
Okay, so JCI is the global player. What about closer to home here in India? The sources mentioned NABH.
Right, NABH, that's the National Accreditation Board for Hospitals and Healthcare Providers. They're kind of the key equivalent here in India.
Part of the Quality Council of India, I think.
That's right, a constituent board.
Yeah.
Their job is basically to establish and operate accreditation program for healthcare organizations, setting benchmarks specifically for the Indian context, catering to consumer needs here. And they operate with functional autonomy.
Okay, so you've got JCI globally, NABH nationally, setting these standards. But I imagine actually putting those standards into practice in a busy hospital, that's a massive job, right? How do hospitals manage that?
That's a great point. And that's exactly where healthcare consultancies like Supreme Medic that we saw in the sources come into the picture. They act as partners.
Partners, how?
They bring in the expertise, the practical know-how to help hospitals translate those, sometimes quite complex, standards into their day-to-day operations and even into their physical buildings.
What kind of practical help are we talking about?
Well, the sources list quite a range right from the start, like
Okay.
helping with hospital planning, the actual design, even recruiting the right doctors and nurses.
Okay.
Then there's implementing the quality management systems themselves, specifically mentioning help with NABH and an ABL accreditation.
Hold on, NABL? What's that?
Good question. NABL is the National Accreditation Board for Testing and Calibration Laboratories.
So for the hospital labs.
Exactly. NABL accreditation is specifically for ensuring the hospital's diagnostic labs are up to scratch, making sure your blood tests, scans, all that are accurate and reliable, which is obviously absolutely crucial for getting the right diagnosis and treatment.
Got it. So these consultancies help hospitals meet standards for the whole organization and for their critical labs. Makes sense.
Precisely. And they go beyond just the systems. They help with managing the day-to-day operations and even big infrastructure projects.
Like what?
Things like setting up specialized operating rooms, the sources call them modular OTs, or installing medical gas pipelines.
Modular OTs. Medical gas pipelines. Okay, so really fundamental stuff for patient care and safety.
Yeah, they're real physical building blocks. They bring that practical engineering and operational knowledge. The sources even mention an equity partnership model they offer for investors wanting to build quality hospitals, showing how involved they can get.
And they back this up with expertise, right? I saw Dr. Vishnoi mention.
Yes, Dr. Surta Ram Vishnoi. His background was highlighted as an example MBBS, MS, which is Master of Surgery, DMS in Management Studies, even training at IIM Ahmedabad. It shows that blend of deep medical understanding and the management strategy you need to run these complex operations effectively.
That makes a lot of sense. So you've got the big bodies, JCI, NABH, setting the vision. Then you have consultancies like Supreme Medic on the ground, helping hospitals actually do it. It's this whole ecosystem, really, aimed at making care safer, more reliable, which, at the end of the day, is what matters to us as patients.
Exactly.
Yeah.
It all circles back to building that trust and aiming for the best possible outcome and experience when you need care.
Okay, but even with the best systems in place, navigating your own health journey can still feel, well, daunting sometimes.
For sure.
You get a complex diagnosis or maybe a treatment plan that feels overwhelming. It's natural to want clarity, to feel really confident.
Absolutely.
And that brings us squarely to the personal side of this, the value of getting a second opinion.
Yeah, and the Supreme Medic Lifeline source dives right into this. A second opinion, fundamentally, is just getting another qualified healthcare professional to look at your case.
To review everything. Diagnosis, treatment plan.
Exactly. Your diagnosis, the recommended treatment, maybe your overall medical situation, just another set of expert eyes.
And why do people typically seek them out? What were the main reasons highlighted in the source?
The sources laid out some pretty clear reasons. Maybe you need to clarify some serious doubts, say, about a cancer diagnosis or a major surgery being proposed. That's a big one.
Understandable.
Or perhaps you want to know if there are other treatment options, alternatives that maybe weren't discussed initially, exploring all avenues.
Right.
Or sometimes, honestly, it's about gaining reassurance, getting that peace of mind that you're truly on the right track with the proposed plan.
Those all sound like incredibly valid reasons. It really feels like an important part of being an informed, empowered patient, doesn't it?
It absolutely can be. Often, seeking that second opinion is a really valuable, even necessary, step toward making confident, informed healthcare decisions for yourself.
And here comes the big caution sign from the sources, right? Well, getting a second opinion is generally a good thing. The way you go about it matters a lot. They specifically warn about the pitfalls of what they call jumping hospitals or hospital shopping.
Yes. This is where it can get tricky and potentially counterproductive, even harmful if you're not careful. The sources spell out specific things not to do and the negative consequences that can result.
Okay, lay it on us. What's one of the big don'ts they really hammer home?
A major one is don't constantly switch doctors or hospitals without a really solid clinical reason, just hopping around.
Why is that so bad?
Well, the sources explain it really complicates your care journey. Think about it. Every new doctor needs time to review your history, understand your case properly.
Which takes time.
Exactly. It can cause significant delays in getting treatment you might actually need.
Right.
And if you're just seeking opinion after opinion purely for reassurance, without a clear clinical question, it can backfire.
How so?
It can just lead to confusion. Different doctors might have slightly different phrasing or minor variations in approach. Even if the core diagnosis and recommended path are the same, too many voices can just muddy the waters.
Okay, so avoid hopping without reason. What else? They also mentioned something about respecting the first doctor.
Critically important, yes. Don't just disregard the original doctor's opinion out of hand. You've likely built some rapport. They have your initial history.
Right.
The sources really stress respecting and considering their expertise. Just automatically dismissing their advice or ditching your primary care doctor because you saw a specialist once. that can damage trust, hinder communication, and frankly, potentially harm your health if you discard valuable insight.
What about where people get their advice from? Any warnings there?
Oh, definitely.
Uh,
Another huge pitfall.
mm?
Getting swayed by opinions that aren't based on solid evidence.
Like what?
Like rumors, things you hear from friends, stuff you read on social media. The sources strongly warn against changing doctors or treatments based on that kind of hearsay or personal bias.
So no miracle cure chasing based on a Facebook post.
Exactly. Your decisions need to be grounded in credible professional medical advice, not unverified claims. Ask questions, gather real data from trusted sources.
And what about expectations? Should you expect the second opinion to be drastically different?
Not necessarily, and that's a key point the sources make. Often, especially for well-established conditions, the second opinion might align very closely with the first. It's often a good sign. It suggests consistency and reliability in medical practice for your condition. The sources caution against continuously jumping from doctor to doctor, hoping for some radically different answer that might not exist.
Just chasing a specific outcome you want to hear.
Right. It can lead to unnecessary delays and frustration. They make the point that there's often no single magic solution. The focus should be on what's genuinely best for your health, not just finding an opinion that perfectly matches what you're hoping for.
Okay, practical point here, but sounds crucial. Your medical records.
Absolutely vital. This came up again and again. Don't show up for a second opinion with incomplete or inaccurate records. That's a recipe for disaster.
Why is it so critical?
Because the new specialist needs your full story. All the reports, the test results, notes from previous doctors, discharge summaries, prescriptions, records of consultations you've already had, everything.
Without it.
Without it, they're working in the dark. They might misunderstand your situation, miss crucial clues from your history, order repeat tests you don't need, or even reach wrong conclusions. Transparency about your full health history is just non-negotiable if you want accurate advice.
And maybe the most serious pitfall they warned about, the one with potentially the biggest direct health impact.
Delaying necessary treatment while you're still out there shopping for more opinions.
That sounds risky.
Extremely. The sources are very clear on this. Postponing essential treatment, especially if you're dealing with something critical like cancer or heart disease, while you wait for a third, fourth, fifth opinion that can directly harm your health.
So if the first and second opinions generally agree on the need for action,
then delaying that action, just hoping for a better answer down the line, can be truly detrimental. They use the phrase, early intervention is key. Don't put off something confirmed as necessary just because you're holding out for some perfect, perhaps non-existent alternative.
the consequences they described for this kind of, well, chaotic approach sound pretty severe.
They really do. They talked about things like ending up with conflicting treatment plans that just leave you confused and unable to decide.
Analysis paralysis?
Exactly. Or undergoing expensive and unnecessary repeat tests. Doctors missing vital parts of your history because you didn't share everything. Miscommunication between providers, increasing the risk of medical errors, and ultimately a breakdown of that crucial trust in the doctor-patient relationship.
They even gave some stark, real-life examples, didn't they?
Yes, really sobering examples. A cancer patient forced into multiple repeat biopsies because records weren't shared properly. A cardiac patient stuck, unable to make a decision because of conflicting advice from uncoordinated doctors. Even a child with epilepsy who ended up on different, dangerously overlapping medications prescribed by different specialists who weren't talking to each other.
Oh.
And there was that quote that really summed it up. Medical care is not like shopping more opinions don't always lead to a better deal.
Oof. Yeah, that quote really hits home. Okay, so if that chaotic hospital hopping is the problem, what's the solution? How should you go about seeking a responsible second opinion, one that actually helps instead of hinders?
Right, the constructive path. The Supremedic blog laid out some really clear best practices. And the first one might actually surprise some people.
What is it?
Inform your current doctor that you'd like to seek a second opinion.
Really? You tell them?
Yes. The source emphasizes that a good, confident doctor should respect your desire to be fully informed. Ask them politely for a summary letter explaining your diagnosis and current plan, and gather your latest reports from them to take with you. Open communication.
That makes sense, actually. Keeping everyone in the loop avoids misunderstandings later. Okay, what's next?
Second, and this builds directly on avoiding the pitfalls we just discussed, carry your complete file.
Hammering that point home again.
Absolutely. It's that crucial. All relevant documents, reports, prescriptions, summaries, doctor's notes, imaging results, Everything, no gaps.
Okay, complete file. Third point.
Be selective about where you go for the second opinion.
Don't just walk into any clinic.
Exactly. Don't just go to any hospital. The source advises choosing a specialist who has matching or ideally even higher expertise in your specific condition. And make sure the facility itself has the right resources, the right technology for your needs. It's about seeking truly qualified, relevant input.
Makes sense. Quality input, not just quantity. Fourth point. What about managing treatments during this?
This is critical. Avoid overlapping treatments. Don't start a new treatment plan suggested by the second doctor without formally completing or stopping the previous one in consultation with a doctor.
Okay.
And, crucially, make sure you inform both doctors, your original one and the second opinion provider, about all the treatments you're currently receiving or considering. Again, transparency prevents dangerous interactions or confusion.
All right. And finally, after you've gone through this process, you've got the second opinion. What then?
Then, you need to make a decision and choose who will lead your care going forward. Pick one primary doctor or team to be in charge and implement the chosen treatment plan.
And if you do decide to switch,
If the second opinion leads you to change hospitals or your main doctor, make sure you formally transfer all your records to the new provider. Ensure that continuity of care. Don't just disappear from one and show up at the other.
the sources even gave some helpful phrasing for that potentially awkward conversation with your first doctor, right?
Yes, which is great. They suggested saying something calm and clear like, "We'd like another perspective just to be sure we're on the right path. Could you possibly summarize the diagnosis and current treatment plan so we can share it clearly with the next specialist?"
That sounds reasonable, respectful, but clear about your intention.
Exactly. It frames it as seeking confirmation and clarity, not as a rejection of their care. And just to quickly circle back on the don'ts related to these positive steps,
Yeah.
don't hide that you're getting other opinions. That breeds mistrust. Don't pick your second opinion doctor based only on how nice they seem. Focus on their clinical clarity, their expertise. Don't try to juggle multiple treatments from different doctors in parallel without clear coordination. And don't ignore your own doubts or gut feelings, but address them through these proper channels, not by listening to hearsay or social media buzz.
Wow. Okay, this has been quite a journey through the material. We started way up high with the big standards bodies, JCI, NABH, trying to build quality into the whole healthcare system.
Wait, architects.
Then we saw how consultancies help make that happen on the ground. And then we zoomed right down to the really personal, practical challenge of navigating a serious health issue and figuring out how to get a second opinion without messing things up.
Yeah, it really shows how interconnected it all is. And it hammers home that, while getting a second opinion can be a really powerful tool for you as a patient,
Yeah.
it's not foolproof.
Mm-hmm.
It needs purpose. It needs planning.
Yeah.
And it absolutely needs open communication to actually be helpful and to avoid falling into that trap of chaotic, confusing hospital hopping.
And I guess in a way, engaging responsibly as a patient following these best practices actually contributes back to that overall goal of safe, effective care that the JCIs and NABHs of the world are pushing for.
Absolutely. It becomes part of the quality equation. And that quote you mentioned earlier really resonates here. Health is not a trial and error game. Clarity, consistency, and communication are your strongest allies.
That is such a powerful reminder for anyone navigating the healthcare system. Clarity, consistency, communication.
Definitely.
It really leaves you thinking, doesn't it? Given how complex healthcare is and how high the stakes are for your own health, how do you strike that right balance? Seeking enough information to feel truly confident in your decisions, but without sacrificing consistent, timely care, it's a tough balancing act.
It really is. And, often complex care doesn't just involve a second opinion. It involves coordinating care between multiple specialists, a cardiologist, an endocrinologist, a surgeon. That whole challenge of multidisciplinary care is a natural next step from this discussion. And it was actually touched upon briefly in those lifeline sources we looked at.
Definitely a related challenge and maybe a topic for another deep dive. For now, though, this has been incredibly insightful. Thank you for joining us on this exploration of the source material.